Okay, secret number 6. Now, this literally is for the non-medical and private duty. All right. So for the non-medical and private duty, you need to close the door on the price. All right. You need to close the door on the price. When you set that standard on what the price is, you're going to get some patients that are going to be like, oh man, why should I use your company when I can get another company out there to service my mom and dad for $16 an hour? Okay. Why should I pay the $22 an hour? Why should I pay the $25 an hour? So how do you close the door on the price? Remember I told you guys you never disagree? You can literally say, look, I agree that we're $22 an hour. I agree that we're $25 an hour. And I agree that you can definitely get somebody out there for $16 an hour. Now let me ask this question. Yeah, then you can literally go to break down, look, the average potential person that's getting paid is this much. So most of the time is they're getting paid this much an hour, and then there's a difference of that much that goes to the company. The question is that company licensed, bonded, insured? The biggest question, the problems that happen in the past, sir, is that we've seen clients and we've seen stories out there, and I would love to be able to share with you where people want to just hire people independently for their mom and their dad. And what happens is if that worker gets injured and that company is not licensed or not bonded or not insured, well, because your mom is technically the boss who they hired, that person can actually sue your mom for injuries. And so our organization, we make sure that we actually provide you with the information that we're licensed, we're bonded, we're insured, we're approved by the state, we're JCO certified, that's what makes, or we're CHAP certified, that's what makes us stand out. And by the way, did I also tell you about our medication reminder program? Did I tell you about, you can start stacking all the different information, services that you guys offer that makes you guys stand out from the rest? That is your job right there. Close the door on the price. Somebody asks for a discount. Look, you don't have money to give them. Because for your company to become successful, if you're only making a profit of $1 an hour, that's not money. That's not going to sustain your company at all. It's not going to sustain your company at all. You need to be able to make sure that, what are your expenses? Do you know your expenses as a company? Do you know it, out of, let's say, for example, if the profit per hour is, as I say, is $10 an hour, right? After you paid your employee their taxes and so forth, well, you have other fees in the facility. How much is it per client is it going to be? You have your rent, you have your utilities. All these expenses are there. So just because there's a difference of $10, that is going to get diminished. So some people, some companies don't look into that. And that's some of the biggest problems. And that's a whole internal part of your business that you need to be able to work on. We can help you with that, but that's a different subject. But literally, as an organization, you want to close the door on your price. Once you know what the minimum amount of pricing that you can give, you need to stick to that and not allow somebody to get you guys be sold on their decision that you should lower your price. Okay, let's also talk about Medicare, Medicaid, and all other insurances. You need to be able to make sure to close the door and you can accept all these. If you're a Medicare approved agency, that's great. You should be Medicaid. You should be accepting managed care. You should be accepting Blue Cross Blue Shield. Whatever insurance is out there, you need to be working your hard to be able to get in those. Get third party, payers as well. You need to close the door on the price. So for non-medical private duty, stick to a good rate. You don't want to be the lowest. You don't want to be the highest. But at the same time, what you want to do is you want to be between the middle and the highest. You want to put your pricing around that area. And if you actually guys want to report on it, ask for me. I actually have a printout, a PDF from MetLife that's going to be able to give you guys what's the average cost per hour for home care and for non-medical private duty in your state. There's actually a breakdown presentation that you guys can get that, and I would love to be able to share with you guys. So give me a call. I would love to be able to share it with you guys. I'm not going to charge you a thing. I just want to be able to make sure I help you guys out.